Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I am going to discuss about an underdiagnosed condition in our country, which is known as sarcopenia. Sarcopenia is an idiopathic, age-related, progressive and generalized skeletal muscle disorder involving the accelerated loss of muscle mass and function, as well as physical performance such as increased risk falls, physical frailty, prolonged hospitalization, dependency, physical disability and impairment, limitation of mobility, decreased quality of life, as well as an increased mortality. The current research that I'm highlighting today here is a bibliometric analysis that actually aimed to analyze the high cited papers, that is, those who received greater than 100 citations on sarcopenia, to actually provide an insight into publication performances as well as research characteristics of the literature. Now, based on the results, the authors did conclude that sarcopenia research has been predominantly done in the States, Europe, and China, and very rarely being done in low and middle income countries. So, further focus of research should be on the etiopathogenesis, especially at the molecular level, the prevalence in different communities, methods to diagnose it in early stages, and its cost-effective management that the authors concluded on. So to talk to us in detail about sarcopenia and how very little we know about this condition, we have with us today the lead author of the article, Dr. Professor Raju Vaishya, who's a renowned orthopedics and joint replacement surgeon, having an experience of more than 35 years. He's currently a senior consultant at Indraprastha Apollo Hospital, New Delhi. His key interests lie in knee and hip surgery, total joint replacement and arthroscopic surgery, regenerative therapy in orthopedics, arthroscopic shoulder surgery, arthritis and osteoporosis, as well as in research and publications. We welcome you to Medical Dialogue, sir.
Thank you.
So, firstly, if you can briefly explain about sarcopenia, the condition that we are here to discuss about, and how it is underdiagnosed in a country like ours.
Sarcopenia literally means weakness of the muscles, which is age-related. So, many people after the age of 50 or 60 tends to feel that their muscles are weak, which is manifested in various ways. So this is sarcopenia. Its incidence is quite prevalent, but since it is difficult to diagnose because the awareness about this entity has been very low in our country, and hence many people who had these problems were diagnosed as aging process, and nothing much can be done, and so on. So now it has been realized, especially in the Western world, that there is a definite condition called sarcopenia, where muscles become weak and they tend to shrink, and hence the overall strength of the muscles, especially of the lower limb and back, and sometimes of the upper limb also, tends to decrease, leading to various problems that are associated with it. So there are two types of sarcopenia identified. One is primary, which is age-related. As you grow older, your muscles are likely to become weak, especially after the age of 60. But there are other causes called secondary osteopenia, where sarcopenia is associated or precipitated by several other conditions like obesity, diabetes, chronic kidney disease, or chronic illness of any type, which leads to bedridden position of the patient, and so on, steroid intake. And hence it is important to realize and recognize that this condition does exist and has major consequences on one's life.
Great, sir. So, what are the key factors that a healthcare professional should actually keep in mind when diagnosing such individuals? As in, what will be the symptoms that the patient usually will present with?
Number one, high index of suspicion and awareness about this entity is important to make a diagnosis. And most of the diagnosis can be done clinically by patient symptoms. Patients usually present with loss of stamina, difficulty in performing their activities of daily living, slow walking, difficulty in climbing stairs, difficulty in getting up from the chair, poor balance, and recurrent falls. Sometimes people report that they have frequent falls, and they might also notice decrease in the muscle size of their leg and thigh muscles especially. So these are the common presenting symptoms by which one can raise a suspicion. Then it can be confirmed with the help of further imaging techniques like CT scan, MRI scan, where you can actually see the muscle mass, which the size of the muscle mass, which has been reduced in sarcopenia. In DEXA scan, one can see associated osteoporosis also in these patients.
That's good, sir. So, if I talk about your research, any particular key takeaway points that you would want to highlight on?
Sarcopenia, although is quite prevalent in our country, I believe, because our population is aging, but since there are no definitive diagnostic test and lack of awareness, this condition is often neglected or not diagnosed in time, leading to increased frailty in patients, increased falls, and sometimes leading to fractures related to osteoporosis and aging. So this is a area of concern. Our research was done to analyze the literature published on sarcopenia in last 30 years based on Scopus database information, and we only examined the papers which were published and had high citation index, means they were cited more than 100 times by other authors after the publication of this paper, their research paper. And we found that total number of papers published in last 30 years were around 6,219, and out of these only 6.4%, that is 398 papers, were highly cited papers of greater importance, and all of them were published from developed countries or high income countries like US, Europe, and now China. None of the paper was published from low and middle income countries like India, Southeast Asian countries, and so on, where large population of the world lives in these areas and have surely high incidence of sarcopenia. So we need to have the methods to diagnose it, create more awareness, do more research by inviting more funding on this topic, and try to find ways and means of dealing with this problem in our own innovative way rather than relying on the outcomes of high income countries, because their method of diagnosing and treating these conditions may be different and more expensive, which is not affordable in our part of the world. So simple things like there are simple tests like a chair stand test, where patients are asked to stand from chair without support and see how many times they can come up and come down in 30 seconds. Then you can check the strength of the wrist and hand by a simple tool. One can check the speed of the patients by making them walk for 4 minutes and see that in sarcopenia there is reduced gait speed. You can measure the circumference of the calf and arm to check the diameter of the arm, that indicates the muscle mass loss, and so on. So these are simple tests that those can be done, and one can reach to a diagnosis and prevent several complications like major fractures of the hip, spine, and wrist, etc., which is common in osteoporotic patients, which are also in this age group.
Great, great. So, as you mentioned, sir, I think awareness is the key point. Lord, as I was reading your paper, it still mentions that it is one of the underdiagnosed conditions in our country. So, an awareness, definitely there will be more and more of healthcare professionals who will actually sit down and come to diagnosis of a condition like this. So, I think that will definitely be a key takeaway point to add on.
Thank you. Yes, I agree. So awareness is the key, and high index of suspicion. One should not neglect patients who are elderly and complaining of simple things like loss of stamina, difficulty in walking, difficulty in climbing, because if you diagnose and treat it early, you can prevent a lot of complications and improve the quality of life of these elderly patients.
Very true, sir. So, thank you so much, sir. Thank you for your valuable insights on this topic. Thank you for joining us today here.
Thank you, Dr. Nandita. It was a pleasure to have you for this interview. Thank you.
Thank you so much, sir.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.